Welcome to this bite-sized session from the Inclusion and Equity Programme, an online professional learning series brought in partnership by the South East Improvement Collaborative and Education Scotland. The focus of this session is to recognise the importance of acknowledging the impact of COVID-19 on children and young people's health and well-being, and how we as practitioners might mitigate those effects. The session starts by sharing the voices of children and young people about the impact of COVID-19 on their health and well-being, and then moves on to revisit some key national supportive guidance that can support practitioners plan learning through health and well-being. As we move forward, key themes are identified to help schools and practitioners consider how to mitigate the effects of COVID-19 on children and young people's health and well-being. Finally, when considering partnership working, the valuable partnerships and supportive interventions of the educational psychology services across the South East Improvement Collaborative are highlighted with signposting to their supportive guidance and resources. It's important to note here that all links mentioned in this session are available in the accompanying SWAY, and recorded presentations from the Educational Psychology Services can be found on the CEIC and Education Scotland YouTube sites alongside this presentation. From the Lockdown Lowdown survey, it's clear that children and young people's health and well-being deserves renewed focus. I'm going to ask you to pause for a moment to reflect on those voices that you've just heard and to think about these two questions. What do those young people's messages mean to you, and what might they bring into your classroom, school or setting? What have you noted are some of the implications of remote learning on family relationships? So take a moment to think, are you noting any changes in learners' behaviour in your setting or during online learning? And if so, what are they? What about levels of attendance or engagement in remote learning, or perhaps reflecting back to when schools were open last? What about levels of arousal? Were some learners anxious, or did you observe hypoarousal? Were there any changes in how some learners have coped with transitions? And were there any notable changes in how parents or carers have engaged with their child's learning and with you as the class teacher? We will come back to how we might mitigate some of these effects that have and are being observed by practitioners. For now, we are turning to the national context to revisit some key guidance that might support practitioners in their planning for health and wellbeing in schools and other settings. The Health and Wellbeing Principles and Practice paper identified the importance of partnership working across services, with young people's health and wellbeing benefiting strongly from a partnership approach. In this bite-sized session, it's important to draw upon the value added from the educational psychology services across the SEEK region. Please check out the bite-sized narrated PowerPoints on the Education Scotland YouTube site and also on the SEEK YouTube site. These bite-sized narrated PowerPoints will also be made available through the Inclusion and Equity programme SWAY. Edinburgh Psychological Services has provided 2 narrated PowerPoints, the first of which, COVID-19 Resources to Support Young People, Families and Schools, shares the work of the psychological services during the course of COVID-19 pandemic, in which they developed a number of short guides to support parents and carers. Recognising the high volume of information and resources, and at times this can feel overwhelming, the aim of the guides was to give parents and carers short reference documents that were reassuring and pulled together a small number of resources and key principles to apply to home learning and other key areas they were likely to be supporting their children. The second narrated PowerPoint, Moving On, Coming Together, which again can be found on the SEEK YouTube site and Education Scotland YouTube sites, is aimed to support schools as they prepared to welcome pupils back following the first period of home learning triggered by the COVID-19 pandemic. The City of Edinburgh Council recognised the return would raise mixed emotions in many children, families and school staff. The psychological service was keen to ensure there was a focus on health and well-being during the transition back. As a result, a range of resources were developed to support the well-being of children, parents and staff as they returned to Edinburgh schools. This work was done in partnership with council colleagues and the wellbeing team. The other link is to access the narrated PowerPoint from Fife Council Educational Psychology Service. The Educational Psychology Service has tried to make their existing resources to support emotional wellbeing more accessible to professionals, parents and young people by developing their website spaces. These include resources such as Resilience Assessment and Intervention Tool, Coaching Conversations Pack, and Anxiety is Normal, Learn How to Control It School Resource Pack. Fife Educational Psychology Service also provided information and developed wellbeing resources during the pandemic to support schools and families to manage their needs in the current context, and the presentation talks through those resources and also includes using a trauma-informed approach to support the return to school, guidance for staff, providing online information and advice for young people aimed at helping them with their concerns as expressed in the Lockdown Lowdown report, adapting the service bereavement and loss leaflets for COVID-19 and updating the traumatic incidents guidance. East Lothian, Mid Lothian and Scottish Borders Educational Psychology Services have provided a range and wealth of many helpful practical resources that you can access through the Inclusion and Equity programme SWAY.